One of the most common joints which is frequently injured is the knee joint. In any sports, the most common joint which is involved will be the knee joint. So we are just going to see about some of the major aspects of the knee joint in today's session. The knee joint is the largest and the most complicated joint, as well as a complex joint. Why is it so? What are the articulating surfaces which takes place in the knee joint? The knee joint is not only between the condyles of the femur and the tibia, but there is a sesamoid bone on the anterior surface, which is the patella. So the articulating surfaces of the patella with the femur also forms a part of the knee joint. Okay, so that's why this has been mentioned as the most complicated and most complex type of joint. Now, what type of joint it is? We all know that it's a synovial joint, but what type of synovial joint is it? It's a type of hinge joint as well as a plain gliding joint. The hinge joint is between the femur and the tibia, and the plain gliding is between the patella and the femur. Now, as in any other joint, the joint is being covered by means of a capsule along the margins. However, the capsule doesn't cover the knee joint completely. There are certain defective parts, okay, some lacunae in the lacunae or openings in the capsule. So, in the anterior aspect of the capsule, there is a small lacuna, and that's because of the extension of the synovial membrane. The extension of the synovial membrane of the knee joint extends. This is referred to as the suprapatellar bursa. I'll be showing you the picture later. And posteriorly, there is a lacuna, and that's because for the passage of the tendon of popliteus. There is a muscle called popliteus in the posterior aspect of the knee joint, and the tendon of popliteus passes through a defect in the posterior aspect of the capsule. Though there are defectives, there are certain structures which add strength to the knee joint. So, what are these structures which provide additional strength for the knee joint? So, these would be the vastus medialis and lateralis, which are part of quadriceps femoris, both on the medial and the lateral side. So, vastus medialis and lateralis. And in the posterior aspect, it is by the oblique popliteal ligament, which is nothing but an extension from the semimembranosus muscle. Okay, you know that the semimembranosus is a part of the hamstrings. So this is an extension, the ligament from it, which is the oblique popliteal ligament. It provides additional strengthening on the posterior aspect. Here we can see the ligaments of the knee joint. So here you can see the quadriceps muscle, the vastus medialis, and the vastus lateralis. So they strengthen the capsule of the knee joint, okay, on the medial as well as on the lateral side. Now on the posterior aspect, here you can see the semimembranosus muscle, and there is an extension from it, which is the oblique popliteal ligament. Okay, you can also see that the tendon of popliteus, the capsule has been removed here, so you can see that the tendon of popliteus is present here. What are the movements which are possible in the knee joint? Flexion, extension, and when the knee is flexed, you will be able to make a slight medial and a lateral rotation. Okay, this is possible only when the knee is flexed, but not when the knee is in fully extended position. We will see. So we will see the extracapsular ligaments and then the intracapsular ligaments. Okay, the extracapsular ligaments. The extracapsular ligaments, one is the ligamentum patellae, the collateral ligaments, the oblique popliteal ligament. We have already seen the oblique popliteal ligament, the ligamentum patellae, which is formed by the union of the quadriceps femoris Okay, so the ligamentum patellae attached to the tibial tuberosity. The collateral ligaments, there are two collateral ligaments, one on the medial side which is called as the medial collateral ligament, and one on the lateral side which is the lateral collateral ligament. The medial collateral ligament is also referred to as the tibial collateral ligament because there is tibia on the medial side, and lateral is referred to as the fibular collateral ligament or the lateral collateral ligament. Okay, so here you can see the ligamentum patellae, okay, the oblique popliteal ligament, and here in the medial side you are able to see the tibial collateral ligament, which is also called as the medial collateral ligament. Okay, the medial collateral ligament. And laterally here you can see there is fibular collateral ligament or lateral collateral ligament. One thing which I want you to observe, so here you can see this is the fibular collateral ligament. Okay, there is a structure which passes between the fibular collateral ligament, okay, and the structures which are inside the knee joint. So that's, you can see the tendon of popliteus. Okay, it is present between the fibular collateral ligament and the synovial joint. Okay, so the synovial membrane. So there is a tendon of popliteus which is present between the fibular collateral ligament and the tendon of popliteus. I will tell you the relevance of this later as we move on. The other ligaments which help in strengthening of the knee joint are present inside the capsule, and that's why they are referred to as the intracapsular ligaments. The intracapsular ligaments are subdivided into cruciate and menisci. Cruciate because they are like a cross shaped, so that's why it's referred to as the cruciate ligaments. There is an anterior cruciate ligament and a posterior cruciate ligament. Menisci because they resemble like a meniscus in a burette. Okay, so that's why it's referred to as the menisci. So there is a medial meniscus and a lateral meniscus. Now let's see about these ligaments. So here you can see the meniscus. So you can see why this meniscus is present. If you see the tibia, the top of the tibia is flat, whereas the femoral condyles, they are more spherical. So in order to accommodate this, there is a cushioning or this ligament which is present one on the medial side and the lateral side for the medial condyle and the lateral condyles of the femur. So that is the medial meniscus and the lateral meniscus. Okay, so medial meniscus and lateral meniscus. The next one is the anterior cruciate and posterior cruciate. Now this is with reference to the tibia. The anterior cruciate, you can see it arises from the anterior part of the tibia and then it goes and gets attached to the lateral condyle of the femur. Okay, the lateral condyle of the femur. And similarly, the posterior cruciate ligament arises from the posterior aspect of the tibia and goes and gets attached to the medial surface of the lateral surface of the medial condyle. Okay, the lateral surface of the medial condyle. So that is the medial condyle. Okay, it gets attached to the medial condyle. So this is the anterior cruciate ligament and posterior cruciate ligament. These are very important because they help in keeping the femur and the tibia together. So if these ligaments are injured, there will be instability of the knee joint. So that's why this ligament is very important. Okay, so the anterior cruciate ligament and the posterior cruciate ligaments are important because of that. Okay, so now here you can see this is the medial meniscus, the lateral meniscus, the anterior cruciate and the posterior cruciate ligaments. Okay, now one more structure which you need to see, you can see the medial meniscus is very close to the capsule, joint capsule. Okay, and you know there is the ligament which is extracapsular, which is the on the medial side, which is the tibial collateral ligament. Okay, so the tibial collateral ligament will be present. The tibial collateral ligament will be present outside this one. Okay, or the medial collateral ligament. Okay, and Here the lateral collateral ligament is present. Okay, the lateral collateral ligament is present. Okay, or the fibular collateral ligament. Okay. Okay, so now if there is an injury, a blow injury, okay, or injury to the medial condyle, just a second, please. So as I was saying before, the medial collateral ligament, when it is getting injured, the medial meniscus will also be injured because it's in close proximity with the joint capsule. Whereas the lateral collateral ligament, if there is an injury to the lateral collateral ligament, a tear, okay, or an injury to the lateral collateral ligament, the lateral meniscus will not be injured because the tendon of popliteus provides a partial protection for the lateral meniscus. So in case if there is an extracapsular tear of the medial collateral ligament, there will also be a damage to the medial meniscus as well. Unless severe, okay, so the lateral meniscus will not be injured, because if the lateral meniscus needs to be injured, the lateral collateral ligament needs to be injured, will be torn, the tendon of popliteus will be torn, then only the lateral meniscus will be injured. And here you can see this is the anterior cruciate ligament and the posterior cruciate ligament. Now let's see what are the muscles which help in various movements. The flexion of the knee joint is brought about by the hamstrings. Extension is by the quadriceps femoris. The medial rotation is by the sartorius, gracilis and semitendinosus. The lateral rotation is by the biceps femoris of the hamstrings muscle. Now, if you could observe, as I said before, rotation is not possible in the knee when the knee is fully extended. Okay, so why? Because in full extension, the knee goes in for what is called as a locked position. So it is fully locked, and in this position, medial and lateral rotation is not possible. This is to provide stability to the knee joint and helps the person to stand. Now, how does this locking takes place? Now, during the knee full extension, the anterior cruciate ligament gets tightened up. As this anterior cruciate ligament is tightened, it forms an axis around which the medial femoral condyle moves back and internally rotated. Okay, it has a medial rotation and internally and moves a little bit on the posterior aspect, the medial femoral condyle. Then what happens? The collateral ligaments and the oblique popliteal ligaments, they get tightened up. And finally, the iliotibial tract on the lateral aspect, they get tightened, bringing about the locking position. Now, how to unlock this position? So, for the knee flexion, before the knee flexion starts, there is an unlocking of the knee joint. The unlocking of the knee joint is brought about by the external rotation and moving forward of the medial femoral condyle. So in the locking, you have seen that it is internally rotated and it moves backwards. Now it has to be externally rotated and move forwards. So this is brought about by the contraction of the popliteus muscles. Okay, the popliteus helps in externally rotating and moves forward. So this is a very important muscle. The popliteus is a key unlocking muscle. So once it unlocks, all the ligaments, they get loosed. Okay, so that is the anterior cruciate ligament and the oblique popliteal ligaments, the collateral ligaments, they get loosened up and they help in unlocking of the knee joint, and further flexion or medial rotation is brought about by the respective muscles. So here you can see the flexion. During the flexion, the medial femoral condyle, it moves internally rotated and moves backwards, and during the extension, during extension of the knee joint, so the locking of the knee joint happens, so it is internally rotated, okay, and the medial femoral condyle, it moves back, whereas during unlocking it is externally rotated, okay, and it brings about the unlocking of the knee joint. So here you can see the locking and the unlocking of the knee joint, which is shown on the medial condyle. Okay, so during locking, it moves internally rotated and backwards, and during the unlocking process, the tendon of popliteus pulls back. Okay, so thereby bringing the external rotation of the medial condyle, okay, and bringing it a little bit anteriorly, thereby unlocking the knee joint. There are various tests which are performed to help the for the testing the menisci. Okay, so some of these tests are to test the intracapsular and the extracapsular ligaments. To test the intracapsular ligament, that is the menisci, so we use what is called as the McMurray's test. So what happens here, the physician, he puts a pressure over the ankle joint along the axis of the tibia and medially rotates. Okay, here you can see he is medially rotating the ankle and presses the medial meniscus over the medial femoral condyle. If there is a pain, it means that the medial meniscus is torn or there is a pathology in it. And here you can see it is laterally rotated. He is giving a pressure, okay, along the axis of the tibia, okay, and laterally rotating it, okay, thereby compressing the lateral meniscus over the lateral condyle. And if this is injured, it means that the person is having a lateral meniscal injury. Now let's see the other test which is used for the cruciate ligament, the Dreuer's test. So here the knee joint is held in 90-degree flexion and the physician holds the foot so that the knee doesn't get extended up further. Okay, and then he gives a gentle push anteriorly. Okay, so he gives a gentle push over the anterior aspect, and if the anterior cruciate ligament is torn or injured, the tibia will come forward. Okay, then later on he gives the same pressure on the posterior side, and if the tibia goes down posteriorly, it means that the posterior cruciate ligament is torn. All right. The sagging test. Here also you can see the physician is holding the knee joint in 90-degree flexion. So normally what the physician observes to see if there is any sagging. Okay, so here if there is a sagging like this, okay, so it will look like this. If it is like this, then it means that the cruciate ligaments are injured. Okay, so because of the injury to the cruciate ligament, okay, so there will be a little bit of sagging. So this is called as the sagging test, which is used for the cruciate ligament. Now, in case of arthritis, we know that there is fluid collection inside the synovial fluid. So the knee joint has got the synovial fluid, and how to check if there is any arthritis or increased fluid collection inside the synovial cavity. So what here the physician does is he compresses the patella, okay, superiorly, and he keeps both his index and the thumb finger on the lateral aspects, okay, and check for any fluid push. Okay, so you know that if there is an increased amount of fluid, the patella, if it is compressed, the fluid is pushed towards the medial and the lateral aspects, and that will hit the fingers. So this means that there is increased fluid collection in the synovial cavity of the knee joint, indicating that there could be some pathology in it. This test is referred to as the patellar tap. Now there are various other things which are referred to the knee joint. So some of the important parts is the suprapatellar bursa. So it is a bursa which is present above the patella. The articularis genu, it's a small muscle which is present. I will just show you in the next picture. The relationship between the crucial ligaments and the synovial membrane, I will describe this too. The popliteal bursa, it's a bursa which is present in the popliteal fossa, the infrapatellar folds and the alar folds. So here you can see the suprapatellar bursa. So there is the extension of the synovial membrane. okay, on the superior aspect. So this is referred to as the suprapatellar bursa. So why there is this extension? Because when there is the knee joint goes in for flexion, when the knee joint goes in for flexion, okay, so this part, so you know that when it is flexing, the femoral condyles will occupy this position. Okay, so that's why there is this extra space provided, which is the suprapatellar bursa. And you can see there is a small muscle which opens this suprapatellar bursa all the times and is attached to the quadriceps femoris tendon, and that is the articularis genus. Okay, so the other bursa here you can see there is a prepatellar bursa and an infrapatellar bursa. Okay, the prepatellar bursa, when it is inflamed, we refer to as it as the housemaid's knee, and the infrapatellar bursa, when it is inflamed, we refer to it as the clergyman's knee. The other points is here you can see the infrapatellar pad of fat. Okay, and there is a small fold here which is of the synovial membrane. This is referred to as the infrapatellar fold, and in between these folds here you can see there is an alar fold. Okay, the alar fold. So these all help in maintaining the integrity of the ligaments which are present inside the capsule. Another point which you need to note is the synovial membrane. In the synovial membrane, you can see it is enclosing the meniscus. The meniscus is present inside the synovial joint. But if you observe the cruciate ligaments, the crucial ligaments are present outside the synovial ligaments. So the cruciate ligaments are present outside or extra synovial, okay, whereas the meniscus, they are inside the synovial, okay, synovial membrane, okay. So here you can see there is a person with who comes with a swelling, okay, and you can see another person. So this, compared to this swelling, this is swelling, there is a patella, this is present below the patella. So this is an infrapatellar bursitis, and here you can see this swelling is present over the patella, and this is referred to as the prepatellar bursitis. Okay, that is an infection of this bursa. Okay, and as I said before, the prepatellar bursa, if it is inflamed, it's referred to as the housemaid's knee, and the infrapatellar is referred to as the clergyman's knee. There are many other bursae which is related to the knee joint, the suprapatellar bursa, which we have seen it before, the popliteal bursa, which is present on the posterior side, a semimembranous bursa, which is present below the semimembranous muscle, the anserine bursa between the sartorius, below the sartorius muscle. Okay, and there are bursas which is related to the biceps, medial and lateral head of gastrocnemius as well. Okay, so here you can see these bursas. So suprapatellar bursa, the prepatellar bursa, the infrapatellar bursa, anserine bursa, and the semimembranosus bursa. Okay, so you can see all these bursas. So there are a lot of bursas which are present around the knee joint. Okay, and inflammation of any one of these can lead on to a knee joint pain. So you need to note that a person coming with a knee joint pain, okay, the pathology can be anywhere. It can be extracapsular or it can be intracapsular or it can be the inflammation of the bursa as well. Here you can see there is an extension of the synovial fluid outside and it is protruding on the posterior side. Okay, so this is called as the Baker's cyst. Okay, so this is nothing but an extension of the synovial membrane on the posterior aspect in the popliteal fossa. Okay, so this is referred to as the Baker's cyst. Okay, so here also you can see the Baker's cyst, the synovial membrane protruding out on the posterior aspect, okay, in the popliteal fossa. The nerve supply to the knee joint, so it follows the same, the Hilton's law, the muscles which supply the which help in the movement of the joint, they also help in supplying the knee joint. So here you can see on the anterior aspect it's by the femoral, medial it's by the obturator, lateral by the common peroneal, and posteriorly it's by the tibial nerve, which is a branch of the sciatic nerve. So with this, we come to the end of the knee joint. If you have any queries, you are welcome to uh, ask me. Okay, you can email me or you can give in the comments below. Thank you.